Welcome to 12-Day Health. I'm Dr. Derek Da Silva. We're continuing our discussion on dental health this week. Joining us once again is Dr. Michael Gruber. He is with Gruber Dental in Parsippany. And he's here to talk about some new technologies helping dentists detect and treat cavities earlier and more effectively. Also joining us is dental hygienist Jennifer Mazzio. I hope I said that right. And also here with a brave patient of Dr. Gruber's is Julia Martin. Well, welcome to all of you. Let's get right into this. Tell us about this technology.
Technology we're using is the latest state-of-the-art technology. It's called Spectra, and it's a high-resolution, high-sensitivity camera that will shine a blue-violet light onto the tooth, and that tooth will, the bacteria in that tooth will fluoresce and come back with different colors, very similar to Doppler radar.
Okay, so Jennifer, let's do this. Let's see what we got in there. And we're going to see if we can try to capture some of these images as we get in here, and then we have some stills on this also. And don't you love, Julie, when dentists talk to you when you have stuff in your mouth? How does that feel? Will's all right. But anyway, the full screen. Okay, that technology. So can you comment on what these pictures are here?
So you'll see on the screen, on the right-hand side, you'll see, just like a Doppler radar, healthy enamel will show up as an apple green color.
Okay.
When we have initial caries, it'll show up as a blue color. Okay. When the caries is in the enamel of the tooth, the cavity is in the enamel of the tooth, it becomes a red color. When it's a little deeper in the secondary layer, which is called the dentin, it'll become an orange color, and it's very deep, it becomes a yellow color.
Oh.
So it's just like a storm. You'll see it on the tooth, and it'll be able to locate the seriousness, the size, and the location of the decay.
So the advantage of this over what you guys did before, was it X-rays that you used before?
We used to use X-rays. We still use X-rays to show decay in between the teeth, and sometimes on the if it's deep decay. But on the biting surface of the tooth, we always depended on a sharp explorer, a probe that went down there. And sometimes we'd say, yeah, there might be decay there, there might not be decay. This tells us 100% that there's decay in the area and the extent of that decay. And
blue light technology, I mean, we're using it in physical therapy, we're now using it in dental applications. Why is that so good? What's the technology telling us there?
Well, it's telling us it's fluorescing that tooth, and the bacteria in that tooth will set off a certain wavelength and the energy from that, so it's almost 100% accurate. Okay?
And the hygienist does the procedure, it doesn't hurt, right? I mean, there's nothing there, there's no pain?
There's no pain. The hygienist does the procedure in our office, but we also use it in our operatories. As we're excavating decay, we can go back with the Spectra and see how deep that decay is and if we've eradicated it all.
To all of you, thank you very much for being here. And she wasn't screaming at all, so that was great. And here's a look at what's coming up tomorrow. And remember, you can catch 12-Day Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. It's time now for our Health Bite of the Week. Well, ladies, listen up. If you're pregnant or planning on getting pregnant, the Mayo Clinic has a few tips to help you have a healthy baby. Number one, eat good, nutritious foods. Take prenatal vitamins. And don't forget to continue to exercise. And once again, I'm tackling another one of your common health questions today. What causes food allergies? Well, not sure we really know what causes food allergies. What we do know is that the immune system gets very revved and it gets overworked, and that may be one of the reasons that the allergies start to begin. A good probiotic is the key to help all of that. If you have any health questions you'd like to ask me, email them to me at 12dhealth@news12.com. Once again, I thank you very much for watching us today. Here's a look at this week's Community Health Calendar.